In this video, we will be going over how to clean your room once a procedure is completed and process the instruments. After the patient is dismissed, you will return to your room for cleanup. Make sure to place on a new set of gloves. The next step will be to make sure to remove all barriers covering surfaces in the room. Throw away any disposable items like suctions, air water syringe, gauze, and floss. If there are any items that need to be taken to sharps or biohazard, make sure to handle them with care. Needles need to be capped with the one-handed scoop method, never holding the cap while inserting the needle at the same time to avoid poke exposure. You may also do the one-handed place method. With this, you will place the cap into a holder and push the needle into the cap. Next, you will make sure any sharps are placed back into containers. Take all of these items to sharps. Now collect any sterilizable instruments. Make sure to place all instruments in the cassette they came from for safer and more efficient carrying. Items that should not go into the ultrasonic bath or get scrubbed, like handpieces and Cavitron inserts, should not get placed in the cassette to avoid them accidentally getting submerged underwater. The cassette or single instruments should get placed into the sink, while the other items like the handpieces and Cavitron inserts should get put in specified areas like the baskets to hold them until they can be wiped and bagged. Other specialty instruments that can easily get broken do not go in the ultrasonic bath, like delicate probes or gold instruments. Make sure to follow the instructions of the office you are at. Items should get scrubbed right away to not allow material or blood to dry on the instruments. You should use a bristle or wire brush to scrub the instruments. Never use the wire brush on mirrors to avoid scratches. Rinse the items underwater, then place in the ultrasonic bath and run for the appropriate time. Return back to your room to finish your cleanup. You will need to spray the counter, hoses, and handpiece connections with the disinfectant spray. Make sure to not spray the chair, keyboard, or computer screen. You will then wipe with the disinfectant wipe. Every surface you think may have been touched should be wiped. The chair, buttons, lever to move the chair should be first. Then you can wipe the counter, air water sprayers. Make sure to get around the buttons and down the hose. The suction hoses, make sure to flip the switches up and down and wipe underneath both surfaces and down the hoses. With all of the motor hand pieces, make sure to wipe the surface around where the connections are and down the hoses. It is always better to wipe more rather than less, so if you feel like you should, go ahead and wipe it. It is important to make sure the surface is dry to complete the disinfection process. Once the counter is dry, you can place down your new clean bib and place a headrest cover on the chair as the universal sign that the room is clean. Once the instruments are complete in the ultrasonic bath, you can remove the instruments, rinse underwater, and set on the drying mat. Ideally, you do want the instruments to be dry before wrapping to prevent instrument rusting. Items in the cassettes will be wrapped in a paper and sealed with sterilization tape. You will want to make sure that there are no exposed areas of the cassette. The indication tape will change color when sterile to let you know when the item is done. For instruments that get put into bags, you will select the appropriate size bag and put them in. Make sure when sealing the bag to fold across the seam and press tightly to create a good seal. There will be color indicators on the bag that will change color to let you know when the item is sterile. Next, you will place your items in the sterilizer. Make sure to not overpack the machine, as this will inhibit proper sterilization. Use the appropriate selection for the sterilization process, close the machine, and hit start. When closing the machine, you may have to use some force to make sure that it is locked. Make sure to check the water level each time before starting to make sure it's not getting too low. If it is getting too low, make sure to refill with distilled water to the appropriate level. When the machine finishes, it will typically open to vent and the dry cycle occurs. Make sure to let this finish all the way before removing instruments to prevent resting. If an item does need to be grabbed, you can grab that item out, but be careful because they will still be hot, and then make sure to close the machine back to the position it was during the dry cycle. If an item cannot be put in the sterilizer due to risk of melting, you will place it in a cold sterile. This will need to be left in for the specified amount of time for the product that is being used. If a new item is added in, all the items will need to be left in for the amount of time again.